First aid for a cardiac arrest. Cardiac arrest is when a person stops breathing and the heart stops beating. The preliminary step for the first aid is shown in the animation. Tap the victim on the shoulders and shout, "Are you okay?" Simply place your cheek just above the victim's mouth and nose. Look for the chest rise. Listen and feel for breathing for no more than 10 seconds. If no breathing, begin CPR. 30 chest compressions and 2 breaths. Repeat this cycle 5 times, which is approximately 2 minutes. Recheck for breathing. If no breathing, continue CPR. If breathing is present, roll victim on his side to protect his airway. Attempt to have a new rescuer performing CPR every 2 minutes as rescuers tire. Always have the victim on a hard surface, not in a bed. Compressions should be at a rate of 100 to 120 per minute. Each breath should be just enough to create some chest rise. Each compression should be 2 to 2.4 inches deep. If initially, when you breathe for the victim, the air does not go in, retilt the head and continue to hold it all the way back to be sure the airway is completely open. Try breathing again. If the air does not go in, the airway is somehow blocked. Perform CPR. However, each time before you breathe, look in the mouth. If the mouth is empty, try giving a breath. If a foreign object is visible, scoop it out. Then try again to give a breath. Victim may never regain consciousness. Proper positioning of hands on sternum. Use middle and index fingers of your lower hand to locate the lower edge of the victim's ribcage on the side closest to you. Slide your fingers up the ribcage to the notch at the end of the breastbone. Place your middle finger on the notch and your index finger next to it. Place the heel of your other hand along the midline of the sternum next to your index finger. Chest compressions. Place the heel of one hand directly on the sternum and the heel of the other on top of the first. Position your shoulder over hand, with elbow locked and your arm straight. Give 30 compressions. Each should compress the chest about 1 to 1.5 inches at a rate of 80 to 100 compressions per minute.